Oh, you are live. Right? We're live. Yeah. వద్దులేండి వెళ్ళిపోండి టైం ఎక్కువ అయిపోయింది కదా.
No, why not? No, it's not. No, it's not here. It's not.
No, it'll take another second or so for it to come up. మీరు మ్యూట్ లో పెట్టండి అది మైక్రోఫోన్.
Okay, good. Yeah.
Management.
Good morning, everyone. Welcome
Yeah.
to Sanjeevani Ashram's Health and Wellness Series, number 10 today. We'll be discussing diabetes prevention and management. Our doctors, Dr. Shaila Peniti and Dr. Gayatri Bora, will take us through this session today. Dr. Peniti.
Let me just introduce first of all that we do this as part of BP Seva, which is volunteering together for Seva, which is the wing of Jet USA. So under this auspices, we have been doing wellness and series lectures for the last, I guess, for the last 4 months. But the broader umbrella also covers other service, like we generate fundraising for any calamities, natural disasters. Even in India, there's a blind school, tribal school, so we raise funds for that as well. We go to the next slide. So what I'm talking, so Dr. Gayatri is going to talk about the management. I'm going to talk about the prevention. So just to give a few numbers, there is statistics about diabetes. It is quite prevalent. 37.3 million people in the US have diabetes. Of these, there are many who go undiagnosed, 28.7. And I'm sorry, of these, 8.6 million are undiagnosed. So 28.7 are the ones who are diagnosed. 96 million people have pre-diabetes. That means they're just hovering around the pre-diabetic range. And those are the ones who have to be really cautious so that they don't go and develop into diabetes. The incidence largely depends upon the age, the ethnicity, the race, and also the gender. Then we have in India actually 69.9 million people have diabetes. The reason I brought this up is in India, I think they don't have access to healthcare. So a lot of people go undiagnosed. Most of them don't go for regular checkup to their primary care physician or even get blood work. So I think the numbers are much more staggering than what is portrayed here. So more than 40 million people undiagnosed, probably that also should be more than that. So previously it used to be only in the urban population because of the the sedentary lifestyle, not using the right diet. But now even in the rural population, it's catching up diabetes, even though prior to that it was only confined to the urban population. So what are the types of diabetes? So we have type 1 diabetes and then we have type 2 diabetes. So type 1 diabetes, all this is geared towards type 2 diabetes because type 1 diabetes can't do anything. It's an autoimmune condition where you actually develop antibodies towards your pancreatic cells. So you don't make any insulin at all. And so we can't do much about it. That's why type 1 diabetes is early onset. Very young age, you can have, a 3-year-old or a 2-year-old have diabetes and they're dependent on insulin injections and insulin pump. So the whole lectures, which is Dr. Bora and myself are going to address is towards type 2 diabetes. So type 2 diabetes, as I said, is amenable to lifestyle modifications, diet and everything else, and exercise. So as much as it is important to control your diabetes, because you go very high, then you can go into real serious problems. You can go into comatose as well if your blood sugars go more than 400 or 500. But equally important, which is not emphasized enough, is if your blood sugar plummets down. If it drops down, that's because you can go into coma. All your organs are deprived of glucose, and that can have serious consequences, even strokes and heart attacks too. So, as I mentioned, high levels cause a lot of damage that it happens in all the systems. So if you go by the systems, first the eyes, right? So people often present with like double vision or blurred vision. That's because there's high glucose floating around, which can cause changes in the refractive index and then can cause blurred vision. So it's called, that you might have heard, diabetic retinopathy. It causes damage to the eyes. If it affects the heart, then it's cardiomyopathy because heart tissue is like a muscle. It affects the kidneys, get nephropathy. It also affects your nerve endings, and then you have what you call as neuropathy. So again, one more time I'm saying is this is pertinent only to type 2 diabetes, and what are the risks? So if you have a family history, you have a higher risk of getting diabetes. And the risk increases with age. Just like many other conditions, as you get like in the 50s, things start creeping up, right? Whether it is diabetes or high blood pressure or high cholesterol. So then there are certain genetic variations can predispose you to, getting diabetes. But it's very insidious in onset. You may not even realize. A lot of people go to the doctors and all of a sudden they go for a condition. I mean, I'm a neurologist, they come to me, and most of the times I do technical because then they have, I have some, tingling and numbness, and then I do a blood sugar and it's just a whopping 400 or 500, or hemoglobin A1C is like 9 or 8. So very insidious onset. A lot of time it goes undiagnosed unless you get periodic blood work with your PCP. So then lifestyle modifications definitely reduce the risk of diabetes. See, there's an observational study, and I don't know how much merit there is to it, because consuming yogurt, they say, it increases the gut bacteria, the biome. So they say not only yogurt, but any fermented, like people eat the gut, which is cabbage and some meat, something mixed up with people eat. So they say that eating that actually improves the gut bacteria and then actually prevents diabetes, but I don't know, because a lot of Indians eat yogurt, right, in many things, and diabetes is prevalent there. So I don't know how much merit there is in an observational study. So what are the symptoms? So you have excessive thirst that cannot be quenched easily. You have excessive appetite. So you're eating much more than what you normally do. You feel you're not, your hunger is not satiated. You also go to the bathroom very frequently. You call it as urinary frequency and urgency. And then you also develop numbness and tingling, your fingertips and toes. That's what it starts, and then it starts getting more proximally. And you have any wound, usually normally it doesn't take long to heal, but these are slow healing wounds. These are all the signs. Unexplained fatigue, unexplained weight loss too sometimes, but unexplained weight loss needs to be investigated for even a malignancy. But on the benign conditions would be diabetes. You have, like I mentioned earlier, blurred vision, sometimes double vision. You also have some itching and then darkened skin with diabetes that's undiagnosed. So how do you diagnose? So obviously blood sugar. So if it's, fasting blood sugar should be less than, actually now they say it's less than 90, but less than 100. 100 to 125 would be, the pre-diabetic range. Hemoglobin A1C is like an aggregate, it's an average. It checks the blood sugar in the last 3 months. So that's much more of an accurate index, because your blood sugars can vary from day to day. So usually we want the hemoglobin A1C to be, less than 5.7. Ideally 5.7 to 6.2 is normal. So anything, more than 6.2 is diabetic range, 5.7 to 6.2 is pre-diabetic range. Then usually this is glucose tolerance test, usually given to detect gestational diabetes most of the times, but this is where you get a huge glucose load, and then you check your blood glucose. So 140 to 199 levels suggest that you're pre-diabetes. Anything more than that, you're diabetic. So what are the lifestyle changes you can do? There'll be a lot of redundancy between Dr. Boras and mine. I just wanted to let you know, but weight is a main thing. The studies have shown that losing 5 to 10% of the weight can actually significantly impact your risk, lowers your risk. Physical activity, even brisk walking is good enough. You have to do it for a longer duration. You say 150 minutes of moderate intensity exercise. It could be swimming, it could be brisk walking, or it could be cardio. Or 75 minutes of vigorous intensity exercise per week should help you. And of course, the balanced diet. What does the balanced diet consist of? I have a few more slides where I can go into detail, but basically whole grains, fruits that are low in glycemic index, vegetables, lean protein, and healthy fats. So what you need to avoid is a lot of sugary drinks, especially the sodas and juices, which really don't have a lot of juice, they have a lot of sugar, and processed foods and unhealthy fats. Sleep, we may dismiss it, but sleep, a lot of repair mechanisms are during sleep. So you need at least 7 hours of quality sleep per night. That actually impacts significantly. So otherwise, it drives you into inadequate sleep, or disturbed sleep can drive you to insulin resistance, which is like a condition prior to diabetes. And reducing stress. It's easier said than done, but you have to have healthy ways of coping with it. Exercise is one thing. People reduce stress because you release these good hormones called endorphins. They relieve stress. exercise, yoga is another thing, and meditation. Of course, I can't emphasize enough about meditation. So again,
Can you raise your voice for?
Oh, yeah, sure,
Yeah,
sure.
sorry.
So what kind of diet? Like I said earlier, water over juice and sodas is the best way, because juices, I guess, have a lot of sugar in it, and sodas, we all know, is nothing but sugar. Then you want to do whole wheat or legume pasta instead of the white pasta. Whole wheat bread instead of the white bread. That would help. And then protein, that's fiber-rich food, lentils, beans, and plant-based protein actually helps you immensely in lowering those glucose surges. Olive oil is good, avocados and nuts. Pretty much almost all of the nuts are very good. Fried fruits actually increase insulin resistance, and then you have processed meats like hot dogs, sausages, bacon, all these deli meats. They're loaded with sodium because that's what they use to preserve, right? They're all preservatives, and they're also loaded with saturated fats, and they actually worsen your insulin resistance. Processed carbs like pastries, cakes, and cookies, they cause a glucose surge. They have a huge spike, and that is very detrimental to your health. So complex carbohydrates, again, like I mentioned, complex carbohydrates could be fruits which have fructose in it. They don't cause the glucose spike. So they're slowly metabolized. You don't have glucose rise in your blood. Brown rice, whole wheat pasta, they don't cause. So I've listed a few of them which do not cause these glucose spikes and surges. And eating sweets actually with nuts, if you really have to do a lot of Indian sweets, of course, but you can temper the glucose. You can actually glucose surge by actually eating with nuts, which also decreases the glycemic index. Adding fiber in the diet, actually what it does is it slows down the digestion and absorption and prevents the rapid spike again. So the other key thing is small portions. Small portions is a key thing of whatever you eat, I guess. But recent studies have shown that intermittent fasting for more than 14 hours actually helps. Previously, the thinking was small frequent meals, but now actually they emphasize more on intermittent fasting. So what are the various options we can get to practice?
I'm sorry to interrupt. Sometimes intermittent fasting also spikes insulin, right? Like sudden spikes of insulin.
You want to stimulate your insulin. Actually, you want your pancreas to actually stimulate to make more insulin so that you can metabolize if you're in that range.
Okay.
And even for normal people, actually, they want to stimulate that. That's why the intermittent fasting exercise is. You want them to perform optimally. So this is too loud.
No, that's fine.
So sugar-free cereal. Again, what are the various options we always run into? What can I eat? If you are pre-diabetic or diabetic, what can you eat? So what you could eat is a sugar-free cereal with low-fat milk, almond, or soy milk. Soy milk actually has 8 grams of protein, especially for all of us. Most of us are vegetarians, so we have that luxury of getting the protein from there. And fresh fruit and nuts. The fruit you have to choose is like low glycemic index, and most of the berries are. I know berries are very seasonal food, but you get frozen ones as well. As long as you avoid, like mango is, I think, high glycemic index, or the melons are high glycemic index as well. Plain Greek yogurt, fresh fruit and seeds and nuts is actually serves as a very good breakfast, and you also get protein from Greek yogurt. Low glycemic index is actually preferred one, but whatever you choose, any fruits. Smoothies with fruits and veggies and supplemented with protein powder, that'll actually give you protein as well. Avocado toast with whole grain bread is good. And oatmeal actually with fruit and seeds and nuts. And the seeds actually, they've shown that there's a small study. Again, it is kind of observational. They don't have a control wing to it, but they show that 2 ounces of pumpkin seeds lowered post meal sugar by 35%. So whole wheat bread, again, non-starchy veggies you want to see. You don't want to go to potatoes or sweet potatoes, which are high in starch content. You want to choose something like the cruciferous vegetables, which are broccoli, cabbage, cauliflower, Brussels sprouts. You choose eggs, garlic, legumes, and beans. Fish is good source of protein. Avocados, extra virgin olive oil, fruit, nuts, and seeds again. And as I mentioned, I think ad nauseum, whole wheat pasta, brown rice, millets, and quinoa. Salads, again, you're going to choose green leafy vegetables with chickpeas, and this is where we have a problem. We run into problem is sugar dress. I mean, the dressings always have sugar, very hidden content, but if you can use low sugar dressing, that's good. Soups and vegetables, and vegetable soup or bean soup will be good. And seeds include pumpkin, sunflower, chia, and flax seeds. They also help in digestion as well.
But some people say that sweet potato is good, right?
Sweet potato is definitely better than potato. It has a little bit of a low glycemic index, and it does not have as much of starch and adds a little bit of protein to it too. But they're not the go-to for vegetables because they're tubers, right? So yeah. Exercise, we can't emphasize enough about it. Promotes really healthy weight, meaning you have built up more muscle mass. So it promotes healthy weight, increases insulin production, and manages blood sugar levels very well. So even 10 minutes of exercise every day is better than no exercise at all. So a combination, what are the exercises do you do? Aerobic, or you can do strength training exercises. It's usually optimal. And what they say is this is recommended. You don't have to adhere to it, but 1 hour of moderate intensity exercise 3 times a week is recommended. So what it does is release these stress hormones. These are anti-stress hormones, and anti-inflammatory hormones, and they reduce anxiety. So it helps you with dealing with insulin resistance. And I think that's it. Like I said, I can't emphasize enough. There's an adage saying that an ounce of prevention is better than a pound of cure. So that's what we all should gear towards. Thank you. And I will pass it on to Dr. Bora, who has kindly accepted to give this lecture.
So majority of what I'm going to say is probably repetition of what Dr. Shaila already shared. Prevention and management. So just you tried all the things to prevent it, and then you have diabetes, doesn't mean you stop what you are doing already. You continue to do that. In addition to it, you take medications, right? As we all know, diabetes is a lifestyle disease, right? When you have diabetes, you go to the doctor give you medications, and then you think, I just take medications, it's fine. That is not it. If you look at it, the three things of it is diet, exercise, and medications. Doctor will guide you on diet and exercise, but you have to do it. Those are the two you have to own and you have to do it. Medications is the one the doctor is going to adjust based on his expertise, what is working for you, what is not, and if you have any problems with medications. So we have to realize we own the disease. The doctor is there to help it, right? It's majority of it is done by us. What we eat, what we spend, how we can spend it, what type of diet are we taking, right? So that's the biggest part of it. And then we feel like, oh, I got diabetes, I went to the doctor, I take medications. That's not it, right? So you own the disease. It's you, and the doctor is there just to help it. That's what the mindset we have to have, right? So and with the diet, what and how much I have to eat, what I have to eat, it is very challenging, right? There are so many myths out there. So you have to get your help from experts, right? People who are specialized in those fields. Going to a registered dietitian might help, which would be an ideal for you because they can set up a plan based on your weight and your diet preferences and all of that. So keep in mind, healthy eating plan will help you control your blood pressure and focus more on, as Dr. Shaila said, a lot of fruits, vegetables, lean proteins, and whole grains. These should be part of your diet. I know majority of the times, unfortunately, with the Indian diet, it is heavy carb, right? If you're a South Indian, you see the like standard South Indian plate, a lot of rice, and that's white rice. And then you have the dal or you have the vegetable. There probably is 10% of each, and 80% of the plate is commonly filled with rice. So we need to change how we fill our plates, right? And then you have diabetes, but your diet can be followed by the whole family. So if you have it, the whole family follows that diet plan, that will prevent them from getting diabetes. So it makes it easy if the whole family is doing it. We want to also for people who are already diabetic. So it's a win-win situation for both. It helps the rest of the family to prevent, and it helps you to control the blood sugars, right? As I mentioned, not sure the portions and how much and what are the sources. If you have specific diet preferences, definitely consult a registered dietitian and they can go over your plan. If you look at it, this is how our plate should look, right? So your majority of the plate, more than 50% should be filled with vegetables and fruits. Carb should be 1/4 and your protein should be 1/4. And then your drink should be water or non-sugary drinks. You shouldn't be consuming juices, fruit juices. I know majority of the times I hear some of my family or friends ask, is fruit juice better than the fruit? Is it more? I say no. Eat the fruit as it's whole. As the nature gave it to you, eat the fruit as it is because it adds a fiber into it. There are other vitamins and minerals. And then majority of the times you squeeze the juice and a lot of people add sugar into it. So it just becomes such a refined drink. What you did was you took a complex sugar and then made it so refined. So it doesn't help. So we have to remember that.
Is soda stream is bad actually?
Which one?
Soda stream?
Soda stream or
It's a carbonated drink.
carbonated water in-house you make sodas. I guess the syrup is as bad as.
As long as it's not sugar.
Actually, it's
Yeah,
like
it's
it's a gas,
fine.
I think.
Yeah.
So here are some protein sources, lean protein sources. Like if you're non-meat protein sources, I know majority of the people who attend here are vegetarians. I have both of them. So as you can see, milk, yogurt, eggs is fine, mixed nuts, beans, tofu is good. Animal protein, as Dr. Shaila mentioned, you want to stick with egg white if you're doing eggs, majority of it egg white. Fish is fine. If you take chicken, it should be chicken breast. If it's thigh with no fat, lean meats, that should be part of your diet, right? So here are a few fruits and vegetables that are low in glycemic. Berries at the top on that, pears, plums, peaches, pomegranate, grapefruits, cherries. So as I know, like they're not available, berries especially are not available throughout the year, but you see apples are available, right? Oranges are more in winter. So some of them are in summer, some of them are available in winter. So we have to pay attention to what we're buying and what we're bringing into our homes.
But
And-
apples are like generally a little bit has some sugar in
It
it,
has,
right?
but it's
But how it is
high,
glycemic?
it's a high quality carb. So you,
Okay.
so when we say low glycemic, what is glycemic index? If you eat something, if your sugar level goes up too fast,
Right.
too high, right? It rises, it shoots up. That's the problem because then your body can't bring that glucose down. So anything that has a low glycemic, is body slowly absorbing. Your body releases the insulin slowly. So it's the sugars doesn't stay, the glucose doesn't stay in the blood longer,
Okay.
right? So these are all low glycemic fruits and vegetables. And right, I just listed some of the, it's the same slide from before, right? And the carbohydrate foods, what should we include? Substitute your white rice with brown rice or quinoa, right? If you're eating white bread, substitute with whole white bread, right? Chickpeas, all the lentils you could use. So they do help if you substitute them with the white rice, right? So the other part, yeah, sorry.
Potatoes are okay. I thought potatoes are.
Sweet potatoes, right?
Okay.
Sweet potatoes,
are okay.
yeah, sweet potatoes are okay.
Okay.
So the diet is the first pillar. You own and you manage it. The second pillar that is under your control is the physical activity, right? So what you consume, what you have in your body need to be spent for your glucose level to stay steady, right? How we do it? We do it by physical activity, right? It spends calories. Your body starts releasing all those and it helps you keep your healthy weight, right? What you're putting in is what is coming out, weight stays stable, your sugar stays stable. So that's what we have to keep in mind, right? So what it does, in addition to spending up all the calories, all the sugars that you consume, it helps your body make more sensitive to insulin, right? When you say more sensitive to insulin, Even though you have a less amount of insulin, it helps the glucose promote into the cells, promote out of the blood sooner. So that's what it does in addition to helping you spend the calories, right? You should check with your doctor if you have health conditions to make sure you're okay to exercise, and then pick the exercises that make you happy, right? That's something you want to do, right? It could be walking, it could be swimming, it could be biking, whatever you like. So, and then if you like to go with your partner or friend and chat while you're doing that, that's even better, right? Because that motivates you to go and do things. So you might want to think, what is something I like, and when is the time I like? Sometimes I like it the first thing in the morning. I want to go out into the nature and walk with my friend or with my wife, with my spouse, like whoever. So please choose. And then the key is keeping it consistent, right? We ideally prefer you do it consistently, like 2 or 3 times a week when you choose it. If you cannot do 2 or 3 times a week, you still have benefit doing it once a week. Just because I don't have time to do it 2 times a week, not doing anything at all doesn't help. Just even do it, start with once a week, right? And then you can gradually grow up. So you just have a mindset and then realizing it. I know, yes, they are the recommendations, but if you can do the recommendations, just doing at least some of it is still beneficial, right? So it's pretty much what we talked about. Okay. So at least 30 minutes of moderate physical activity most days of the week. On an average, we should have 150 minutes per week of moderate physical activity. So if you're not someone who can from the beginning start with 30 minutes of moderate physical activity, start with 10 minutes, gradually go in increments to 15 minutes, and then based on your work or your lifestyle, it doesn't permit you to do the every day. So just do it 2 or 3 times. Like maybe you should be able to do one day you could spend 30 minutes, another day you can spend 50 minutes. So choose and avoid sitting too long, right? And how do you monitor your blood sugars? Now you have diabetes. Now you're doing your diet, you're doing your exercise. How many times you need to monitor depends on the type of the diabetes you have or what type of medications you're taking. If you're somebody who is taking 1 or 2 pills or maybe even 1 pill, you might not need to monitor your blood sugars every day. If you're somebody who is taking insulin, you might need to monitor your blood sugars. If you're controlled, you can cut it down to 2 times a day. But if you're not and you're still adjusting, your doctor is working with you to adjust your insulin, so you need to check it 4 times a day, right? And then sometimes you have seen now the continuous glucose monitoring have come. Like if you're on insulin, you're a diabetic. A lot of patients who are doing the continuous glucose monitoring. I mean, it's actually, to me, it feels like it's beneficial to a lot of patients, but for a few patients, they get stressed out the minute they see this higher blood sugar level and they panic on it. They get stressed out, and then the blood sugar shoots up again. So it just, you have to choose whether you have to discuss with your doctor, and you have to realize whether I'm a good candidate for this continuous glucose monitoring or not, because sometimes having it, you're checking your sugars every 1 hour and then they're high and you're stressed about it. Maybe it might not be for you, right? And then you have to check your sugar. If your A1C should be checked every 2 to 3 months, especially if you're not controlled. If you're controlled, it's okay to stretch it to 6 months. When your doctor is still adjusting your medications, it's good to get it checked every 3 months. And once you stabilize, we can move on to every 6 months. So remember that. So you have to go to your doctor, get it checked every 6 months, at least, to keep an eye on your diabetes. And if you're not somebody who's checking your blood sugars, even if you check your blood sugars, it might not be the high at the time when you're checking. It could be high in the 24 period some other time, but A1C kind of gives you an average of your blood sugars in last 3 months. So it's a better way to assess the state of your diabetes, right? So every 6 months you should have it checked. If you're uncontrolled, it should be every 3 months while your doctor is adjusting your medications, right? So I know Dr. Shaila touched upon the pre-diabetes. If you're someone who goes regularly to have doctor's visits every year, get your annuals and A1C is a part of annual checkup now. And sometimes you might have heard like, hey, I'm being told I am a pre-diabetic. What do I do now? Because this might be the state time when you can act on and take control of your diet and exercise plan, so it will prevent you from becoming diabetic too soon. Or sometimes you might just stay in the range if you do appropriate diet plan and exercise, right? Healthy life choices, healthy diet, exercising frequently, And then keeping a healthy weight through the exercise can help, right? As mentioned, 150 minutes a week. And if you can cut your body weight by 7% when you're in a pre-diabetic range, that actually helps you not getting into full-blown diabetic. And sometimes, even though you're pre-diabetic, your doctor might give you metformin, which is a diabetic, the first choice for diabetes. Sometimes that also helps you not, your A1C not go into the diabetic range. It is okay to take that medication. It is very well tolerated. The other thing that I want to stress about is if your doctor prescribes you medication, right, you are having side effects from the medication. Sometimes I see that they have diarrhea with that, or they're having headache and they're feeling lightheaded. Majority of the patients just stop without talking to the doctor. They just, and then they don't call the doctor. They don't tell the doctor. So metformin was prescribed 6 months ago. You go for your next visit 6 months later, and the doctor asks you, "Are you taking your medication?" And then they say no, right? And then why are you not taking the medication? And then said, "But I took it. I had some diarrhea." This was 6 months ago. Especially in countries like this, we have the option to contact our doctor, let them know our side effects. So some patients don't even realize that they have to tell the doctor if that medication what was prescribed isn't working for them or they couldn't tolerate. So because if that's not the one, there is another medication the doctor can try out. So please, if you're having any side effects from the medication that the doctor prescribes, please make sure you discuss with your healthcare provider and get other choices.
So
Right.
at that time, because it happened to a couple of my friends
Mhm.
and my family,
Mhm.
so they reduce the dosage of the metformin, or like there are equivalent medications which can lower those kind of diarrhea kind of
It could be either, right? So sometimes some of them, or I had someone who's metformin, for example, 500 is the starting
Right.
dosage, right? You start 500 BID, they're tolerating it well. And then instead of adding another medication, if that's not controlling your blood sugar, your doctor might increase it to 1,000 twice a day,
Right.
right? Then you realize like you're having side effects from that medication.
Right.
So you did good on 500. So then the option would be leave you on 500 twice a day and add another medication. But the big thing is you being able to recognize that I'm having problems with this medication. I need to talk to my doctor. I am so surprised when I hear and ask the question, why you didn't take the medication? And then they say, like, doctor, this medication didn't make me feel good. Then did you tell your doctor that it didn't make you feel good? They look at me like, what? I'm supposed to tell my doctor that? But other than that, how would the doctor know you're having problems with your medication? I have noticed it quite a few times. And then it's 6 months later, right? When you go for your next visit, you're talking about the medication the doctor gave you 6 months before. So just being aware of it. Your doctor is there to help you. If you don't tell, he wouldn't know, right? So there are other alternatives there so they can help. So be realizing it.
I'm sorry to interrupt.
Sure, go ahead.
So then actually my brother, like he started with 500 mg,
Mhm.
mg or mcg, I don't know.
Yeah.
So still he is having that diarrhea kind of
Mhm.
dizziness and all that stuff. Then unknowingly or something like he started like making it like half, like in the morning half and evening half.
Mhm.
And the doctor, and he informed to the doctor later, like
Yeah.
after, and he was fine like with that kind of combination.
Yeah.
So, but usually it will be a one pill, right? Like you need to take it, and is that an okay practice?
So 250 milligram BID is not the ideal starting dose for
Right.
metformin, but if you're taking 250 BID, it is not giving you any side effects. The key is it keeping your blood sugar under control?
that's
If it is not, then you might have to add another medication, you know?
Right.
So 250 BID may not be the thing. So if I was a physician treating your brother, then maybe 215 doesn't do much to you. So let's take you off of that medication and start you other choices, right? So we can go for that. It's a discussion between what you're willing to do. So the thing is, you are your health advocate, right? You have to ask for questions. If you have any side effects, you have to discuss. What can I do? Can I stop? So owning the disease. This is my problem. I am the one that need to get this under control. My doctor is there only to help. That's the mindset you have to have.
Right.
If you think that doctor is going to help with everything, I don't have to do anything. I just take this medication. Unfortunately, diabetes is a lifestyle disease and it's a lifelong disease. So you don't own it and you don't try to manage it, you will have problems with it. Like, and then as we all know, you don't have any symptoms at the beginning, but poorly controlled diabetes leads you to strokes, heart attacks, neuropathy, kidney damage. We have seen all of it. So it's just a mindset we need to have. Is this diabetes is going to win? I'm going to win. If I say I'm going to win, you are the winner, right? You could be on metformin for many years, 15 to 20 years. I have patients whom I have actually one of my family members who I have known him being a diabetic since I was 20 years old, right? And then when in my 30, because he was doing diet and exercise, he stayed good till he's 30, 35 with no medication. And then at 35, he got on metformin. And then and then I'm like, and then 10 years later, he was added another medication because he had controlled the other two things so much, he didn't need that much of medication. So it's your mindset, pretty much like how you're going to do it, right? So first you start with the pills. If it doesn't work, then if the pills are not enough, then your doctor might prescribe once a day long-acting insulin along with the pills. That's how you transition. Sometimes if the once a day long-acting is not enough, your doctor might add you insulin before each meal. That's when you'll be checking your sugars 4 times a day. And then some people who are very capable of managing their diabetes well based on how much they eat, and then the continuous glucose monitoring and insulin pump. Some patients might be, usually it's good, very good for younger patients, so they don't have to interrupt it based on their needs, and the insulin, the levels are sensed and the insulin is given. So it had been working well for a lot of people, but insulin, if the patient is a candidate for an insulin pump or not, it's a combination between the provider and the patient, right? Are you able to manage it or not? Right? So when you have diabetes, as we talked, you need to see your doctor every 6 months. If it's not controlled, you might see them every 3 months. With the resources we have in America, I know I'm not sure whether it will be possible in India. It might be if you have a physician who knows you well and who you can be touched, especially with your EMR. There is no reason why you shouldn't be in touch with your doctor if you have fully control, or if you have a question. Now you can put your questions to your doctor in the app, in the EMR app, and the doctor answers you within 48 hours. So in this age, and then living in this country, having so much access to healthcare, it's not something you want to wait if your sugars are fully controlled. Maybe a week, 2 weeks, that should be enough to contact your doctor, get your treatment adjusted and able to manage it. And you should have vaccinations. You should have flu vaccine. You should have pneumonia vaccine. If you're 65, that's where you start. And then if you have to pay attention to your feet, make sure there's no skin breakdown, there are no wounds, especially with diabetes. What happens is, as a long-standing diabetes affects your nerves are not as sensitive as they are for a non-diabetic patient. So you don't feel pain. You don't feel the skin breakdown. So you have to pay attention to your feet. And then the other two things that you want to get under control is your blood pressure and cholesterol, right? If you have fully controlled diabetes, your triglycerides are going to be very high. So you have to also get those checked and keep an eye on that. And absolutely avoid smoking, avoid alcohol. Those are two things. And then take stress seriously, right? So what stress does is it makes you all the hormones that shoot your glucose up, right? So you have to be able to manage your stress, because it's counteracting what you're doing for diabetes, because it's producing the counter-regulatory hormones to insulin,
Yeah,
and
like
then makes your sugars
people
go.
says that stress is the starting point
Yeah.
for all these issues.
Yes, yes, yes.
Yeah, because
Yeah.
if you're stressed, like you eat more, that produces more
Yeah.
sugar.
Yeah.
And
And the biggest thing I want to share, right, when you diagnose with the diabetes, people feel like you take this medication for a year or two and then it's done. It is not. It's a lifelong disease. Realizing it and having your expectations and goals set is something I'm going to live with and I have to manage helps better. I know when I have seen cases where patient was on pills, the doctor said your sugar is controlled. They went home and they stopped taking the medications, and then they ended up with sugars being in thousands, and some people have passed away because my doctor said my sugar is under control. So they assumed like I can stop the medication, but realizing it that it's something that you will be living with will help you. And also, if you think there are other alternatives or medications or alternative treatments that can cure diabetes, as of now, there is nothing like that. So,
So I heard like in the recent journals and all, some
Mhm.
Chinese scientists and all, they invented a medication for diabetes to cure permanently. And there are some like genetic modification, like CRISPR gene therapy.
yeah, gene therapies are coming. That's for future. Nothing as of now.
Right.
Um,
Screen.
oh, I exited.
Okay.
So as of now, there could be some Chinese medicine that's not approved by FDA.
Right.
If it was really good, it would have been going off. The drug would have been trading in billion places and
Exactly.
it would be skyrocketing. So you could hear it, but I'm like an allopathic doctor, so I believe in what evidence-based medicine, right? I have to see proof that it works, unfortunately. So I won't be recommending
And
something
a lot
out
of
there.
these are claims
Mhm.
actually, like for Parkinson's disease, they say
Nah.
that it's a claim. This is a claim, but it's not.
It's a
not
claim. Like I think
established.
it is still in testing phase. Looks like.
Yeah, but it's has to go through so many several
Exactly.
trials
Yeah.
before it's
Right.
approved. So they do all that. Like for recently, there's a medication for malaria, and that's very well thoroughly established, thoroughly researched, and went through so many trials, and they came up with a treatment for malaria.
Right.
But it would have been out by now. But I don't
Exactly.
think there's much merit to it.
Any questions up in the chat?
Oh,
Yeah.
so any questions?
The other thing is GLP peptides. I want to talk to you
No
about
questions.
GLP peptides. These are the Mounjaro, the Trulicity, and they are a group of, they're called GLP-1 peptides. So before people go into that, like you said, if somebody has metformin and they are not able to tolerate the adverse effects, or if it's not, sometimes you go to 1,000 twice daily and it's just not effective, then you can go on to the GLP-1 peptides. The added benefit, the bonus with that is there's weight loss. So people who are not necessarily obese but overweight, the advantage is they lose weight. In fact, there's a huge industry based on that. They're now marketing it just for weight loss. So people who are non-diabetic are also getting this medication.
The
Simply-
Ozempic.
Yeah, Ozempic, they all belong to the same class, GLP-1 peptides.
Oh, okay.
Mounjaro, Ozempic, Trulicity, and other ones. So they're now exploited for the side effect of weight loss. Yeah,
But
so
are they bad?
long term, they say there is a risk of pancreatic cancer, but people don't worry about it because it's long term. It's a lot of potential. It really controls your hemoglobin A1C comes down pretty significantly, and patients love it. When they love it, they're compliant. And we want that, right? All our physicians can prescribe it, and people love it because it makes them feel good, lose weight, and they're compliant. So one of the medications that promotes compliance is one of the GLP-1 peptides. So there's a lot of primary care providers actually for non-diabetic, they're prescribing off-label as well.
So are they doing it legally?
Oh yeah. We're allowed to do some off-label when there is enough evidence. FDA approves that as well.
Okay.
In fact, Ozempic is being marketed for weight loss as well.
Yeah. Right.
Yeah.
Online question, Andy.
Sure.
Can yoga be substituted for exercise?
Absolutely. Yoga is not aerobic per se, but it definitely reduces stress. 10 minutes of yoga. I know my husband would probably argue against it
That's his question.
because
That's his question.
that's his question. Okay. Okay. So they did some research, which is a very preliminary trial in Harvard. There are these receptors called anandamide. They're named after actually anandamide. So there are these receptors. So apparently, this yoga releases these chemicals which go and bind to these receptors, and you relieve stress immensely. You get this gratification. They looked at the nucleus ambiguous. There's an area called the brain. They have seen changes on functional MRI. So they talk about it, but I haven't seen a really peer-reviewed proper journal publish these results. So I think my husband has a fad about it, but I'm not so sure about
Yeah,
it.
Okay.
yoga also I heard like there are different ways, right? Like, everyone follows a different set of like, yoga practices. And some are like, high cardio intensive.
Yeah, that's what, yeah.
Like Surya Namaskar and all.
Yeah, that huge Surya
Yeah,
Namaskar
that
actually,
really
because it pretty much
definitely-
exercises every part of your body. So it's a
Exactly.
little bit of an aerobic component, a little bit of muscle strengthening,
Right,
but it's not adequate like how people go to the gym and get the workout.
right.
That actually releases a lot of these endorphins. That's why people who go to gym are so addicted, they make them feel happy as well.
Right.
I can see it as my son, he loves to go to the gym, so yeah.
Does meditation help reduce diabetes? So-
Again, meditation is known to actually release these, endorphins as well to some extent. It does, but I don't think it can be done solely. I think it is a supplement to medications if you're in the diabetic range. I am telling you, I'm a pre-diabetic. I tried everything, but I do yoga every single time, every single day. And I don't think, and I lost weight with the lifestyle modifications, more vigorous exercise. I lost weight, but my hemoglobin A1C didn't budge. And I've been, because I have family history, I was just proactive and I went on medication.
Yeah, so if they're thinking meditation alone can prevent you, that is not. It's a
Yeah.
multimodal approach to preventing diabetes.
Yeah, exactly.
You
You
still
gotta
have to
have-
do diet, you still have to manage
Yeah.
your physical activity, and then meditation can help, right? Yeah, go ahead.
Similar question actually. So once, let's say someone has a 6.3 A1C,
Mhm.
can it come down? It will stay, like, let's say with the diet and exercise, are we able to bring it down?
Yes, you can bring it up.
Okay.
Yeah, yeah.
So, or it will stay at that?
No, it can
The
come down.
essence of the medication so that it will keep it at the lower
without
level and
taking
maintain
medication.
it.
No, with diet and exercise, it
Yes.
definitely brings it down.
Okay.
But sometimes it may not, like if you've tried it for 6 months or a year and it is not budging, then probably you need the help of the medication. Just a little kickstart kind of a thing, the medication.
Once one starts taking medication, let us say 6.5, start medication, then when, is it possible to say, stop it after some
It
time?
depends on how you're controlling, but when you stop again, because you already tried diet and exercise and it didn't budge, right? So adding the medication is bringing down to from 6.5 to say 6.2. That means you need the medication and you may need it for lifetime. People are averse to taking medications,
Yeah.
but you have to understand that taking a pill is not as bad as what the repercussions of uncontrolled diabetes. Once it goes to the 7 and 8 range, it is extremely difficult. We see patients day in and day out. It's extremely difficult to control. It becomes so refractory at that time. So popping a pill a day is not as bad as long as you don't have any. Definitely, there are more medications that you can tailor according to your need and your adverse effects.
Right.
So
And
I
then
think-
some patients have asked me the same question, right? So I'll take metformin for 6 months. You think I can stop the medication after if I do the diet and exercise, my A1C comes down? I tell it's less likely, as like what Dr. Shaila said, but I give them that benefit of doubt. Okay, if you want to try and stop the medication for 3 months and let's see where your A1C is. 3 months is okay to do the trial. And then they come back and the number is 6.7, then they know that it's not working. So I guess I have to go back on the medication. Sometimes it just helps you realize, like, you may not be believing what the doctor is saying, but the trial of 3 months, 6
If
months.
someone
check it.
stops medication
Mhm.
and they start it again, will it be less effective because they took some time, stopped
No.
it? Okay.
So medication won't be less effective, but your sugars might be high by then, and then the same dose what was working for you 6 months before may not work. You might need a second medication, or you might need to go on insulin.
So
Yeah.
there's no kind of negative effect because somebody stopped that medication? Okay.
So people think because I stopped, it is not working. It is not that. It is actually because your diabetes has progressed. The same dose that worked for you 6 months ago is not working now. So you may need a second medication, or you might need to increase the dosage of that medication.
Is it possible to predict that, let's say someone is 6.2, is it possible to predict that in 2 years will be 7?
No,
Okay.
because there are a lot of genetics that play into factor, right? As I mentioned, like there was one person whom I know since 30 years, who's only taking one pill for diabetes. There are patients whom I know, like they had been diagnosed 5 years ago and they're already on insulin, and pills are not working, and there are 2 different types of insulins. So it just is also a lot of it also has to do with your genetics, your family history, and your lifestyle.
Also,
Right.
you can
Mhm.
monitor.
Mhm.
Say your hemoglobin A1C was 6.2, and then about, 6 months or a year later, it's creeping up, 6.4. Another 3 months, it goes to 6.4. So the trajectory is going up. So what you need to do is at that point, your lifestyle management, your exercise and diet regimen remains the same. So it's going up. That means it's not effective unless you change dramatically your diet, which can lead to weight loss. And for someone who is lean, it's not something that we would encourage. So at that point, you can go on the medication and see how it works. So that you can see a pattern. If it's just creeping up gradually like that, then you know that, okay, 2 years from now, I can predict probably it's going to go up.
So are either of you aware of any studies on the effect of stress management as an intervention? All the other factors remaining the same, managing stress, reducing stress, and what happens to glucose level?
Absolutely. Because if you're only on diet and exercise management for pre-diabetic patients, and then stress, definitely in 3 months, 6 months time, your hemoglobin A1C can be stable without going up. So that means it's effective. But I don't think stress management alone for a diabetic is not effective.
Understood. But the thing is that when you look at managing diabetes in a common setting, medication, then nutrition, exercise, these are the things. But I don't see that, hey, you are going to see someone for stress. You say manage your stress, that's what they say, but you're not using it as an
No,
intervention.
unfortunately, as a matter of fact, I don't think there are studies looking at all 4 components together.
Right, okay.
The diet, nutrition, medication, and stress management, as opposed to another wing without the stress management for the other 3. So there's no, case.
Okay.
But as you said, in current world, stress management is a big issue, right? And we have the physiologic basis, like all these stress hormones are counter-regulating the insulin effects, right?
Absolutely.
So eventually, I think that is going to
So
come.
my question is why is stress management like why is not like you're checking your blood sugar level, okay? You have a rating scale of your stress level. Okay? There are several rating scales. Then you say, okay, so go to your nutritionist. Your stress level is high. This is what it is. Why don't you go to see the therapist for stress management? I don't think we have.
That's a new avenue. I'm pretty sure that is going to come in the future, especially with the way current state is with the younger generation, with their lifestyle work. I mean, I have a few cousins who are in their 30s, like they all have sedentary jobs. They're sitting and then they're diabetics already, and then their stress levels are too high, especially with these ups and downs with they're not sure about their jobs or what's happening. But I think that's another avenue that probably will become another pillar now with the diabetes and exercise and medication. Stress management probably because it's a physiological basis, like it all counter-regulates what insulin is doing.
Part of the reason I think it took a back burner is, does insurance cover? How many people can afford to pay out of pocket? So if insurance, who's the therapist who'll take your insurance? I mean, as it is for serious conditions, my patients will wait for months together to get to a therapist. So it's just like we don't have the adequate manpower, I think, and somebody who would accept the insurance. So that's why I think it took a back burner.
Is it possible to measure stress?
Oh, absolutely. That's what I'm saying. There are some rating scales to say how your stress is. So that was my initial question. Do you have any study where you are checking the blood sugars, you're checking the stress levels over a period of time, managing something for stress and see what happens to blood sugars?
Just adding to that, we have A1C to measure the
blood glucose, how the diabetes under control for the last 3 months.
Are there any other parameters or
Measure stress?
to measure something that is going to aid to your A1C, like when you do blood test or through talking to people like about diet, exercise, and all that, and say, okay, you're like 0 to 100. On the other scale, like 100 means you are going to increase your A1C level. Say 50 or lower, below means you're either going to control or reduce your A1C. Like one of them is stress. Like if a stress level is,
if you're looking for a marker, is that what you're saying? Is it a blood marker or something to measure the degree of stress?
Like if you see A1C, let's say 6.3, but you look at other tests in that blood test
Mhm.
and say, oh, because these other 10 are saying that probably, it's not going to increase your A1C later because they are going to help you. Like, I don't know if there is anything in your blood test will tell.
Or triglycerides is another thing that because they're also like, sometimes they can be a marker for inflammation too. Then there is something called as a segmentation rate or C-reactive protein, but those measure only inflammation or infection, but we don't have a blood marker to check the stress levels.
Stress or, anything that will either increase A1C or reduce A1C.
Oh, something that predicts,
Yeah,
we don't have
like
anything.
because your triglycerides is let's say 200,
Yeah,
your A1C is likely to increase further. But if your triglycerides is let's say 20, let's say, I'm just saying,
you have
a
a
very low
predict, yeah.
number,
Mhm.
then because this is low, you are not going to have a.
Actually, it's the other way around. Just because it's low doesn't mean your hemoglobin A1C is not going to creep up. But if triglycerides are uncontrolled, most likely, despite all your interventions of exercise and nutrition, chances are that it's going to go up.
So there's nothing in our blood test or any other test that will tell that your A1C is going to either increase or decrease.
Not at this
No,
time.
not at this time. Probably there's a lot of research going on all over, like even for JDWF Foundation, Juvenile Diabetes Foundation, I had a fund from them once upon a time, but that is aggressively looking into that because there are some very young patients who have diabetes and it's a lot of lifestyle and limitation as well in their activities. So there is a lot of research going on. So I think 5 years, 10 years from now, it will just revolutionize. I think we may come up with something so totally different. Like CRISPR technique, what you were talking about. So we may have CRISPR technique to make just more insulin,
Yeah,
Sorry, last question.
Mhm.
When should somebody start measuring the blood sugar at home?
So there are two schools of thought for that. One is definitely if your glucose is out of control,
Yeah.
then you have to.
Yeah.
If your hemoglobin A1C is fairly well controlled, they say is like Dr. Bora was addressing to it, that it actually makes you more stressful because you're thinking, oh my God, my sugar is so high. Now I have to be aggressive in that. So it actually works to your detriment, sometimes checking blood sugar. If your hemoglobin A1C is stable in the last 1 year and it's only 6.2 or 6.1 with medication exercise, and there are no changes, you don't need to actually. You can just rely on the 6-month hemoglobin A1C and the blood glucose level fasting.
You can enjoy your life with less.
So if we are not, let's say
Yeah.
somebody is pre-diabetic, let's say 6.3,
Mhm.
and they're not taking medication, they're not testing.
Mhm.
The next
6 months.
physical is after 1 year, right?
Yeah.
The 1 year period.
Mhm.
So maybe 1 month later, they hit the 6.4, 6.5 mark, and they are on the diabetic for 1 year, almost 1 year. Would it be harmful that they were not on medication for 1 year?
So for you to have changes from diabetes, right? For example, your heart being affected, your neurons being affected, your kidneys, your blood sugar has to be greater than 180, right? That infers to your hemoglobin A1C closer to 7, right? So if you're below 7, ideally we want it close to 6.5, 6.5 to 7. We say it's not very well controlled, but we say it's optimally controlled. So for your blood sugars has to be a certain level for your body to see all the damage that it causes. So it correlates, as I mentioned, to 180 and hemoglobin A1C of 7. So you don't have to panic so much. Like, oh, last year my doctor checked I was 6.4, now I'm 6.7, and a year later, my body took damage already from diabetes? No.
I mean, 6.4.
Yeah.
And should I be worried that probably it hit 7 and then, or
So instead of worrying, maybe focusing on diet and exercise might help to where you put your resources, right? That's what it is. What do I do to not have this A1C go up to a diabetic range? That's what we should be thinking about. So if it's by next year you check it at 7, but I don't want to be feeling bad that I wasted an year but at least it's better than checking a year ago than not checking, right? Majority of the times, unfortunately, people who have diabetes get diagnosed when their A1C is around 8 and finger-stick blood sugars might have been around blood sugars between 250 and 300. I'm being very conservative when I'm saying the number. That's probably even worse than patients come. Yeah.
I'm ending the session.
Thank you.
Thank you, everyone.
Thank you so
Thank you.
much. Thank you.